Welcome to this video on bradyarrhythmia management in the emergency department, focusing on clinical protocols. When managing bradyarrhythmia, heart rate alone does not dictate treatment. Clinical stability is the primary driver for intervention in the emergency department. An unstable patient is defined by CNS effects, such as altered mental status or syncope, hemodynamics like hypotension or signs of shock, and ongoing ischemia or acute myocardial infarction on EKG. The critical drop trend visualizes a precipitous decrease in heart rate, leading to patient decompensation and the need for intervention. A V-block classification categorizes blocks based on EKG morphology and risk of progression. For example, first degree is low risk, while third degree poses an extreme risk of asystole. First-line treatment is atropine sulfate. The dose is 1 mg IV bolus every 3 to 5 minutes, up to a maximum of 3 mg. Avoided in high-degree blocks with wide QRS, and use caution in ischemic heart disease. If atropine fails, second-line infusions include dopamine, dosed at 5 to 20 mcg per kilogram per minute. Epinephrine, 2 to 10 mcg per minute, is preferred in septic shock or profound hemodynamic collapse. Transcutaneous pacing, TCP, is electrical stabilization initiated for unstable patients or if atropine is ineffective. Set the rate to 60 to 80 beats per minute, increase current until electrical capture, and confirm mechanical capture by pulse and blood pressure. Remember to look for specific and reversible causes. This includes hyperkalemia, beta blocker or calcium channel blocker toxicity, ischemia, and hypothermia, each having distinct treatments. The ED stabilization pathway involves initial assessment, pharmacological intervention with atropine and infusions, electrical intervention with TCP, and definitive management like transvenous pacing or a cath lab referral. Transvenous pacing, or TVP, is the definitive ED stabilization when TCP fails or long-term pacing is required. It involves access via the internal jugular or subclavian, a balloon-tipped catheter, and confirmation via EKG and X-ray. Thank you for your attention to cardiac safety. Please feel free to reach out with any clinical inquiries. This final slide lists the image sources used throughout this video.